This video raised some concerns for how his surgery is going, so I'm hopeful to provide some insight on Malik's status and where he should be after this type of injury post-op 2 to 3 months. So we look back at when the injury did happen. It was week 4 of this 2025 NFL season. On this play here, you see on that lower extremity, you see Malik trying to change directions and basically that knee giving out. So it was later confirmed that he did suffer that ACL tear on this play and then underwent surgery later in October. Based off some resources, it seems like maybe he suffered also a torn meniscus too. So we're going to assume that it wasn't just an ACL reconstruction surgery that they completed, but maybe also a meniscus repair. Now for rehab purposes, an isolated ACL tear is one thing, but when a meniscus repair is added, rehab becomes a lot more structured, to potentially slightly longer and maybe even more cautious early on. A quick anatomy recap, we have our ACL seen right here in green, and then between both the femur and the tibia we have our medial and lateral meniscus. These play an important role in absorbing force through the lower extremity as well as assisting in the role of nourishing that knee joint. So based on the typical timelines and rehab structure, Malik Nabers is likely in the mid to late strength and movement phase of recovery. So at that stage, he's basically focused on restoring to that full range of motion in the knee, building the quadricep and hamstring symmetry and strength. And typically, you're looking at off crutches around week 6. So the fact that he's still on crutches is definitely concerning. It's over more than 2 months, and he's still using crutches as seen in this video. The fact that he's still on crutches means that the knee has not obtained full function yet, so potentially it's not regained that full range of motion that they are hopeful or one of the goals for this phase of recovery has been achieved yet. Right now, there's a lot of uncertainty if that 9 to 12 months is when exactly his full recovery will be. So I feel like the realistic concerns for potentially missing week 1 is definitely real. However, not completely for sure. And like we talked about, it's going to be very important to see how he progresses with his rehab throughout that offseason.